Hello everyone, I'm Dr. Munazza, I'm consultant periodontist. Welcome to M.Perio Prep Course series. In this series, I'm going to discuss different topics and the most common and important questions which are asked by RCS examiners during M.Perio exam related to these topics. So, the first topic which I chose is diabetes. Diabetes seems a very simple and common topic, but don't get fooled by it, because whenever the examiner will ask about diabetes, you have to follow certain protocol to give a satisfactory answer. Here I am going to ask some of the common questions asked by the examiner and how you can give answer or how you can tackle or handle these questions. So let's start. So the questions which examiner can ask you is that, doctor, tell me, what are the questions you will ask this diabetic patient in history before the procedure? So as a candidate, your answer should be, or these are the important points you should tell the examiner, is that number 1, since when the patient had diabetes. Number 2, current medications the patient is taking. Number 3, current HbA1c value, because it will tell the blood glucose level in the past 3 to 4 months. Number 4, any previous episode of hypoglycemia during the procedure. And number 5, any complication which might develop due to diabetes. So this should be your answer. So the next question examiner can ask you is that, doctor, tell the common oral complications that could happen in poorly uncontrolled diabetic patient. So as a candidate, you must include these conditions. Number 1, xerostomia, dental caries, infections that could be bacterial or fungal. Number 4 is gingivitis. Number 5, periodontitis, burning sensation. These are the common complications which a diabetic patient complains. So examiner can ask you, tell the protocol for the dental management of a well-controlled diabetic patient. So as you know, in a well-controlled diabetes, the HbA1c value is between 6 and 6.5 generally. So you will tell as a candidate to the examiner that you don't need to take any special precautions. You will do all the procedures without any special precautions. Just I will tell the patient that come early morning, have your breakfast, have your medications, and the most important thing is that come at the start of the week for review purposes. This should be your answer. The examiner can ask you, what is the protocol for the dental management of poorly controlled diabetic patient? In this question, you will tell the examiner that, or you will follow this sequence. Number 1, you will tell the examiner that all the elective procedures will be postponed. Number 2, you will provide only the patient emergency treatment. You will consult with patient GP. Number 4, before doing any procedure, you will monitor patient BP, ECG, and sugar level and respiration. Number 5, you will provide the patient immediate treatment, no delays. Number 6, you will maintain a verbal communication with the patient during the treatment or during the surgery. And number 7, you will advise the patient to inform you or your assistant in case any symptom of hypoglycemia will occur. So the examiner can ask you, what is the most common diabetic emergency that could happen? And as a candidate, your answer should be hypoglycemia. And examiner can also ask you, related to hypoglycemia, that what is the protocol for the management of hypoglycemia. So in hypoglycemic patient, you have to tell examiner that if the patient is conscious, then you will give the patient glucose either in the form of drinks or tablets. If the patient is unconscious, then you will inject 1 mg of glucagon in adults and 0.5 mg of glucagon in children under the age of 8 IM or IV. Then you will wait for 10 minutes. If there is recovery, then you will give the patient oral glucose. If there is no recovery within 10 minutes, then you will inject IV glucose. You will call an ambulance and you will transfer that patient or admit that patient in hospital. So that is the sequence you need to follow for the management of hypoglycemia. So these are some of the important questions related to diabetes which can come in M.Perio exam either in written part or the examiner can ask in short and long cases. So I hope this video is helpful for you, and I'm also conducting a full comprehensive M.Perio preparation course that will start on 20th June 2023. Only 3 seats are left. So if you are interested, you can message me on this number, and the next batch will enroll very soon. So I will share the dates very soon with you guys. So take care and see you in the next video.